Hello, everyone, and welcome to Module 3. So this one is a big one. There's a lot of content. So in Chapter 8, with our fluid and electrolytes, acid-base balance is a lot of information. So things to remember. You want to know signs and symptoms, treatments, and the causes, because typically treatments are going to aim to help correct whatever's happening based off of different numbers. So what are those numbers associated with the different electrolyte levels, the different acid-base balance levels? And then part of those treatments also aim at fixing whatever the cause of the problem was, if possible. You will find, particularly in our acid-base balance one, when you have patients that have respiratory issues, whether it's acidosis or alkalosis, those patients that have chronic respiratory conditions may not actually be able to completely fix their problem. So they may always be at risk for going back into that state. So we'll have to watch their compensatory mechanisms a lot more closely. For chapter 21, 22, 23, and 24, that is our hemopoietic system. So we're looking at what the blood cells do. And one of the big components of that is that oxygen transport, and then of course, nutrient transport. The shapes of those cells will also do things for us. We're going to be talking about coagulation within those chapters. So how does the blood actually clot, stop? And sometimes problems with that, of course, go along with increased bleeding risks, increased clotting risks. Maybe they can't actually transport oxygen. We also have the white blood cells that we're going to be discussing. So white blood cells are one of the things that we watch very closely, and it's a big indicator of infections. So if you think back to that infectious diseases module, white blood cells were mentioned in there in those chapters. Increased white blood cells. White blood cells are our body's way of fighting things, so they are our part of our big piece of our immune system. When those go up, typically means we have an infection. But what if they can't? So a lot of the problems in that realm are around lack of the body's ability to respond or an over response, because sometimes we can get to states where we start attacking ourselves, which isn't good either. So a lot of content. I am splitting up your guided notes this week. Chapter 8 itself is huge, so that will be in a separate link, and chapter 21, 22, 23, and 24 will be in a separate one as well. You will also start to see all of those quizzes and exams, things from Lippincott being pulled over, so if it looks a little odd in the grade book, no, I am fixing those as we pull those over. If you have any questions, as always, please remember, send me an email via the Google Maricopa email is the best way. Reach out, make some office hours, and have a great week.